Hello and welcome. I'm Dr. Akash Prabhu, Neuro and Spine Surgeon at WIINS Hospital, Kolhapur. I specialize in endoscopic spine surgery, and today I'm here to tell you about lumbar disc herniations and how to prevent them and how to treat them. Now, what is a lumbar disc herniation? It is more commonly known as a slip disc among the public. This happens when somebody takes an excess load, like while playing sports or bending forwards, or when you lift weights or fall down. That time your spine, which is made up of vertebral bones and the disc, which is the shock absorber in between, gets pressed, and the disc material comes out and presses onto your nerve, which causes back pain and something called sciatica. Now, what is sciatica? Sciatica is a characteristic pain of lumbar disc herniation, which starts in the back and spreads through your buttock and back of your thigh to your legs. It could be one-sided or spread to both sides of the legs. This happens most commonly due to a lumbar disc herniation. What causes lumbar disc herniations? This is a model of your lumbar spine. These are the vertebral columns and this is the disc between them. The disc is a shock absorber that helps absorb impact of daily activities like walking, running and jumping, and prevent it from affecting the rest of your body, and especially this thing here. This is your spinal cord and the nerves that travel through it, and these are protected by the whole spine. Now, when you lie down, your disc is at rest and there is no pressure in it. But when you stand up, the pressure in it doubles. When you sit down, the pressure is almost 3 times, and when you bend forward while sitting down, the pressure can go as high as 20 times in the disc. This can sometimes cause the disc to herniate and press onto your spinal nerves, causing back pain, which is known as sciatica. One of the lesser known causes of disc herniation is a sedentary lifestyle. A lot of us now are in desk jobs which require staring at the computer all day and working on the computer. Now, when you do this, your posture tends to be bad and your back starts slouching. This causes increased pressure and an abnormal posture of your spine, which leads to increased pressure in your discs, and over time can lead to disc herniations. This, coupled with a sedentary lifestyle and lack of back strengthening, can eventually lead to disc herniations even among young and fit individuals. In case there is a disc herniation, you will have uncontrollable pain going from the back through your buttocks and back of the thigh to one or both sides of your legs. There could also be tingling and numbness of the lower limbs, and in severe cases there can be weakness of the feet, causing your foot to drag when you walk, and slippage of chappals from your foot. There can also be problems to pass urine, where you will have to strain to pass urine and there will be difficulty in controlling the urination. There can also be problems to pass your bowel movements. Now, how is a disc herniation diagnosed? The best way to diagnose a disc herniation is through a MRI of the back or the lumbar spine. This shows us the vertebrae as well as the discs, and if there is any compression on the spinal cord and the nerves that travel through there. In case there is a disc herniation, what to do? Very small disc herniations can be managed by bed rest and certain medications. These medications reduce the pain and discomfort, and over time a small disc herniation can go back and stop pressing on the spinal cord. But in case it is a big herniation which has intolerable pain, or tingling, numbness or any weakness of the legs, this usually requires surgical intervention. Now, for a young individual with a contained disc herniation, endoscopic spine surgery is a great new modality that has come up for treatment of lumbar disc herniations. What is endoscopic spine surgery? Endoscopic spine surgery is surgery for lumbar disc herniation through a very tiny opening, usually 15 to 18 millimeters, just big enough for one finger to go in. Through this we put an endoscope and we take out the disc herniation that is pressing on to the spinal cord or spinal nerves. This procedure usually has a very quick recovery. You get admitted one day prior to the surgery, or in some cases on the morning of surgery. Surgery usually takes between 1 to 3 hours to perform. Recovery is immediate. Patients get relief from the back pain immediately after surgery, and they are made to walk within 3 to 4 hours after the surgery. The patient is discharged home the very next day of surgery, after which light activities can be carried out at home from the next day itself. There is usually just 1 or 2 stitches put, which can be taken out at a later date on a OPD visit to the hospital. Initially, rest and just minimal activities are recommended. Within 2 or 3 weeks, we will start some physiotherapy for back strengthening to help prevent these herniations in the future. So, what is the cost of endoscopic spine surgery in India? The cost is variable. It depends on your insurance package, what class of rooms you take, and what city you are in. Us, WIINS Hospital, being in Kolhapur, offers this surgery at a very affordable cost to all the patients. Patients can get admitted on the day of surgery and are discharged the very next day to carry out regular activities at home. We are empaneled with a lot of insurance companies, and you can contact our office for details of whether your insurance is acceptable at our hospital. How does one prevent a lumbar disc herniation? Maintaining a healthy lifestyle. Weight loss in most cases helps take load away from the spine and helps prevent a disc herniation. Back strengthening exercises are often ignored even by regular gym goers. This is very important so that your whole body's weight is transmitted through your muscles and does not only go through your spine, causing pressure on your disc. Having a back cushion at work and a footrest go a long way in preventing lumbar disc herniations. So to conclude, lumbar disc herniations can be caused due to increased pressure in your lumbar disc, which can be caused by lifting weights, bending forwards and being overweight, and having a bad posture while sitting in a chair. This can be prevented by exercise and back strengthening physiotherapy. For lumbar disc herniations, endoscopic spine surgery is an excellent treatment choice. When compared to open spine surgery, endoscopic spine surgery offers a better alternative to young people with lumbar disc herniations who have an active lifestyle and who wish to maintain this lifestyle even after surgery. You can go back to your normal activities on the very next day of surgery, and with regular physiotherapy and back strengthening, your back health can be better than ever before. So I urge everybody to maintain a good posture and sit with a straight back when you're at work. Thank you.